Next, Dr. Tintu Susan Joy. She's a consultant in cataract and glaucoma, Giridhara Institute, Kochi. She'll be talking about nucleus management in SICS.
Good morning, everyone. Thank you for this opportunity. Today, I'll be speaking about nucleus management in cataract surgery, small incision cataract surgery. So we know there are several techniques for nucleus delivery in SICS. But the basic principle involves two steps. That is, first prolapsing the nucleus out of the capsular bag into the anterior chamber, and then extracting the nucleus out through the sclerocorneal tunnel. So here our aim is to have a traumatic extraction of the nucleus. That is, you should preserve the capsular bag, protect the corneal endothelium, and prevent damage to the neighboring structures like iris. So during this procedure, there are two distinct obstacles. First is at the level of the capsular rhexis. So like how Madam have already told, if your rhexis is small, you may end up in trouble. You will not be able to prolapse a hard cataract through a small rhexis, and it may lead to zonular dehiscence. So always your rhexis should be of adequate size. And second is at the level of the sclerocorneal tunnel. So like Madam already mentioned that the tunnel should be titrated according to the density of the cataract. If you have a hard cataract, you need a larger tunnel, and if it's a soft, it can be even smaller. So for beginners, during the learning curve, safety is the priority, and I feel a bigger rhexis or a bigger tunnel is safer in learning curve. Now, how to prolapse the nucleus out of the capsular bag into the anterior chamber? If it's a very soft cataract with a continuous curvilinear rhexis and your rhexis is of adequate size, you can always try a hydroprolapse. In hydroprolapse, you inject a fluid wave at the margin. You can see the fluid wave passes under the nucleus, and it increases the hydrostatic pressure within the bag, and a nucleus pole prolapses out. Then it can be dialed out easily with the help of a hook, Hinsinski hook. In hard cataract, it's not advisable to use hydroprolapse. So in such cases, it is better to use a bimanual prolapse, where you can use two dialers to prolapse the nucleus out of the capsular bag. Here, make sure your rhexis of adequate size, and after doing the hydro procedure, make sure your nucleus is rotating well. Then with two dialers, that is with one dialer you push the nucleus slightly downward, and with the other dialer you wheel out the nucleus out of the capsular bag into the anterior chamber. And always there should be enough visco in the anterior chamber, or if it's a very hard cataract or if your endothelium is compromised, always use a dispersive viscoelastic. Nucleus delivery, like I have mentioned the names, there are several techniques for delivering the nucleus out of the sclerocorneal tunnel. So all these procedures, the basic principle is you should guide the nucleus towards your wound and then express it out through the sclerocorneal tunnel. So how to guide the nucleus into the tunnel, it depends upon, either you can use hydrostatic pressure as in Blumenthal technique or irrigating wire vectis technique, or you can use visco to increase the pressure in the AC, guide it towards the wound and then prolapse it, or even you can use instruments to guide the nucleus towards the wound. Once the nucleus is engaged in the tunnel, then you can depress the scleral lip and prolapse it out, still continuing the increased hydrostatic pressure. And in nucleus division technique, you can divide the nucleus in either bisect or trisect the nucleus so that it becomes smaller pieces, and then prolapsing it through a smaller tunnel becomes easier. But it's little more difficult and requires a more learning curve. So I will show some videos. Here, this is a visco expression. It's a very soft cataract. You are injecting the visco above and below the nucleus, and then while still continuing to inject, and you have to press the scleral lip. So easily the nucleus prolapses out through the sclerocorneal tunnel. Always make sure your tunnel is of adequate size before attempting this procedure. This is another video where you can see it's a hard cataract, a slightly bigger nucleus, and the wound was not adequate. So you can see the iris is prolapsing instead of the nucleus. Again and again we are trying to dial it out, it's not coming. So in such cases, it's better to increase the size of your tunnel or use an instrument to deliver the nucleus. Now coming to irrigating via vectis technique, this is a very useful technique. It can be used even in a hard cataract. It's easy to deliver with the irrigating via techniques. Here the principle is increasing the hydrostatic pressure inside the anterior chamber to deliver the nucleus. So this is a video. Always before doing the nucleus delivery, make sure enough visco is there inside your anterior chamber, coat the endothelium, especially if it's a very hard cataract. So after that, always check the patency of your irrigating vectis. Then with the concave side up, you should, the irrigating vectis should enter into the AC. Once it's advanced below the nucleus, it's better if you can visualize the tip of your irrigating vectis so that it's not catching hold of your iris. If it catch hold of your iris, it may lead to iridodialysis while prolapsing it out. It may be very difficult to visualize the end of your vectis if it's a very hard cataract, or if the pupil is too small. Sometimes you may catch hold of the iris. That is a complication of this technique. Okay, so once it is engaged, once it's engaged in the tunnel, then that is the time you should on the irrigation, press the scleral lip and prolapse the nucleus out. Again, one more video. So you are entering, engages the nucleus, bringing it towards the wound, the nucleus is engaged in the wound, and then you on the irrigation. With the other hand, you can just give a hold on to the superior rectus so that your eye will be turned down, you can get a counter traction also. Okay. And Blumenthal technique is a technique where you use the increased hydrostatic pressure to prolapse the nucleus. So this, I'm just showing the video. Here you use a AC maintainer to increase the hydrostatic pressure of the anterior chamber, and you can prolapse the nucleus by depressing the scleral lip or with any needle. Actually, in the original procedures, they use a lens glide to prolapse the nucleus out. So this is a video which I got from a different doctor. So here they increase the hydrostatic pressure, press the scleral lip, or with some instrument, it can be prolapsed out. Phaco sandwich technique is also a technique of nucleus delivery. Here you use two instruments to deliver the nucleus, where you can use a vectis and a dialer and sandwich the nucleus in between that, bring it towards the wound and then express it out. So here also make sure there is enough visco in your anterior chamber to prevent damage to your corneal endothelium while delivering the nucleus. Thank you.
Thank you, Dr. Tintu. That was well covered. All the aspects was covered well.